President Donald Trump recently claimed that using the common painkiller acetaminophen, or the more common brand name Tylenol, during pregnancy is fueling the rise in autism diagnosis. He then even went on to suggest that pregnant women should tough it out rather than use this painkiller if they experience fever or pain. So this announcement caused alarm and confusion worldwide. Is there scientific evidence to back up this claim that acetaminophen used during pregnancy is the cause of the rise of autism in our country?
I'd say at this point, are there some studies showing a link? Yes. Are they showing what we call causation? I would say not enough at this point. There's a common phrase in epidemiology that correlation does not equal causation. So there are studies that correlate the use of Tylenol with increased rates of autism, although it'd be kind of like the consumption of ice cream is correlated with sunburns. Doesn't mean that ice cream causes sunburns. It's just that ice cream and sunburns both tend to happen more in the summer.
Mhm.
And so it doesn't mean that one causes the other. So are there studies showing that there seem to be higher rates? Yes. However, the way to sort this out is to do something called a randomized controlled trial. And the
Okay.
problem is it'd be really, really, really difficult to try to do that in pregnancy for all kinds of reasons. And we can go into those if you want to. Probably the best study came out last year was a Swedish study where they studied close to 2.5 million Swedish births, because Sweden has a registry of all births essentially, including things like, did mom take Tylenol? And what they did to try to sort out things was they actually were able to use two siblings, like one child has autism, the next child or the child before did not. Was there a difference in Tylenol use? And there wasn't actually. That when you controlled for the siblings, all those associations went away. That's probably the best study to date that I think would provide some reassurance that could there be a correlation? Of course there could. There always could be some causation there. But the studies to date, I would say at this point, I would be fine with taking Tylenol in pregnancy. To the point where if my daughters were to get pregnant and they said, Dad, do you think it'd be okay for me to take cauliflower if I would say yes. Now, if things are not 100% until you have the 100% study or more studies, and I think there's recently been a Japanese study replicating the Swedish study. And so if you control for those things, and the other thing, there's something in epidemiology, something called the Hill criteria. If you don't have a randomized controlled trial, are there other things you could point to that make you more confident that this is okay? And the Swedish study actually looked into other things. One is something called the dose response. It said women took more Tylenol versus less Tylenol. Did that seem to correlate? And it didn't. So there are a lot of things that the Swedish study correlated for, and they also looked at other things too. So things like taking other pain medicines or migraines or things like that. Also, it's correlated, but also went away when you did this link control. So to me, I don't think the evidence justified that announcement. I think that was driven by politics.